Being a caregiver, it's one of the most profound things a person can do. It comes from a place of love, of deep compassion, but let's be honest, it can also be one of the most demanding, most exhausting roles anyone can ever take on. Today, we're going to look at that really delicate balance, that journey from burnout all the way to resilience.
And this quote, wow, it just hits the nail on the head, doesn't it? It perfectly captures that constant push and pull that every caregiver feels. On one side, you have this immense love, and on the other, there's this very real and often very silent physical and emotional cost. And the scale of this is it's staggering. This isn't just a handful of people. In Australia's mental health system alone, the economic value of informal caregivers, family, partners, friends, is estimated to be over $13 billion a year. They are, quite literally, a silent pillar holding up our healthcare system.
Which brings us to the big question, right? The one we're really digging into in this explainer. With so many people pouring every ounce of their energy into others, who's making sure they don't run on empty? Who's looking out for them?
So first things first, we need to really understand the true weight of this role. We're going to explore what experts call caregiver burden and really uncover the often invisible symptoms and risks that come right along with it.
So the clinical term for this whole experience is caregiver burden. And it's so important to get this because it's not just about feeling tired. No, it's a state of complete exhaustion, emotional, mental, and physical, that can affect every single corner of a person's life.
Now, what's really fascinating is how researchers break this down. They talk about objective burden. Think of this as the tangible stuff you can see and measure. The financial strain, the lost hours at work, the chaos it brings to family routines. But then there's subjective burden. And that's the internal experience, all those personal feelings of stress, grief, and just being completely overwhelmed. Both are incredibly real.
So how does this actually show up in real life? Well, the signs can be pretty subtle at first. We're talking about that deep down exhaustion that sleep just can't seem to fix, or finding yourself feeling irritable or angry more often, maybe losing interest in the hobbies you used to love. Each one might seem small, but you put them all together and it's like your own life is slowly starting to fade into the background.
And the stakes here, they're incredibly high. If this chronic caregiver stress is just left to fester, it can lead to some really serious health consequences. We're talking about an increased risk for high blood pressure, a weakened immune system, and a much higher chance of developing clinical depression and anxiety. This is so much more than just feeling stressed. This is about your long-term health. Okay, now here's where things get really, really interesting. You'd probably assume that the specific illness of the person being cared for would be the biggest factor in a caregiver's stress level. But is that actually true? Let's take a look at what the research found. A huge systematic review, which is basically a study of other studies, tackled this exact question. They pulled together the findings from 28 different studies, covering over 6,000 caregivers, to get a really clear picture of what's actually driving this burden.
Researchers specifically compared caregivers of people with schizophrenia to those taking care of people with bipolar disorder. And the results were, they were surprising. While a few studies did find a greater burden in one group or the other, the majority, a full 14 of them, found no significant difference at all. And this leads to a really profound conclusion. The diagnostic label itself isn't the main driver of the stress. It's the day-to-day experience, the severity of the symptoms, the level of difficulty with daily tasks, the behavioral challenges. In short, what a caregiver deals with matters a whole lot more than what it's called.
You see how this insight just completely changes the game? If the day-to-day reality is what matters most, then the solution isn't really about the patient's diagnosis, it's about the caregiver's resources. So how can they build a support system that's actually sustainable?
All right, in our final section, let's actually build that toolkit. We're going to shift from just understanding the problem to exploring real, actionable strategies for building up that resilience and protecting your own well-being.
It all starts with a concept that sounds simple but is unbelievably powerful: self-compassion. Now, this isn't self-pity, and it's not about being self-indulgent. It's about actively treating yourself with the same kindness you would show a good friend, especially when you feel like you're failing or just completely overwhelmed. And research actually shows this mindset can be a powerful shield against depression for caregivers.
So what does this look like in practice? Well, it's about building your own personal self-care toolkit. This is not a one-size-fits-all deal. It's a three-part process. First, you learn to recognize your own unique warning signs of burnout. Second,
You start proactively building habits that protect your well-being. And third, and this is absolutely crucial, you figure out when and how to ask for help, because you were never meant to do this alone.
Let's make this super concrete. This means giving yourself permission to set realistic expectations because you simply can't do it all. It means scheduling breaks without feeling guilty. It means prioritizing sleep and healthy food. It means making time, non-negotiable time, for hobbies that fill you back up. You have to remember, your health isn't a luxury. It is an absolute necessity for this role.
And hey, if you need a little more motivation, just think about this. The research is crystal clear. The mental health of a caregiver is directly at risk. For instance, having a partner with depression significantly increases your own risk of developing it too. Self-care is a preventative measure. It's that simple. This quote from Dr. Chelsea Mndanka just reframes the entire conversation perfectly, doesn't it? Self-care isn't selfish. It is not taking something away from the person you care for. It is, in fact, the most fundamental thing you can do to make sure you can continue to be that effective, compassionate, and present caregiver for the long haul.
So we'll leave you with this question. And it doesn't have to be some grand gesture. Maybe it's a 10-minute walk. A phone call to a friend you haven't spoken to in a while. Maybe it's just 5 minutes of blessed quiet with a cup of tea. What is the one small, manageable step you can take today to start refilling your own cup?